How does EMDR help with intrusive thoughts and PTSD? Imagine your mind as a busy library where traumatic memories are stored like scattered, incomplete books. When these memories aren't processed properly, they can cause intrusive thoughts that keep popping up, often uninvited and distressing. Eye movement desensitization and reprocessing, or EMDR, is a therapy that helps reorganize these mental books so they're less disruptive. It works by helping the brain reprocess traumatic memories that are stored in a fragmented and distressing way. This reprocessing reduces the emotional intensity tied to these memories, which in turn lessens how often intrusive thoughts happen and how distressing they feel. During EMDR sessions, a therapist guides the person through specific bilateral stimulation, often using eye movements, but sometimes taps or sounds. While focusing on a traumatic memory, the person moves their eyes back and forth, which mimics natural brain processes during rapid eye movement sleep. This process helps the brain unstick the traumatic memories, allowing them to be integrated into the broader network of memories in a way that feels less upsetting. As a result, memories that once triggered intrusive thoughts or flashbacks become less emotionally charged and easier to manage without feeling overwhelmed or wanting to avoid them. Intrusive thoughts in PTSD are unwanted, repetitive images or ideas related to past trauma that can cause a lot of distress. EMDR doesn't ask people to argue with or suppress these thoughts. Instead, it targets the original traumatic experiences or beliefs that made them possible. By reprocessing these memories, EMDR reduces the emotional reaction to the thoughts, making them less powerful. This helps individuals gain psychological distance from intrusive thoughts, so they don't provoke as much anxiety or lead to compulsive behaviors. The foundation of EMDR is the adaptive information processing model, which suggests that PTSD symptoms happen because traumatic memories are stored in a dysfunctional way and aren't properly integrated with other memories. EMDR helps the brain process and connect these memories correctly, reducing symptoms like intrusive thoughts, flashbacks, and nightmares. It's usually done over several sessions, often around 3 months, and is recognized as a highly effective treatment for PTSD by major health organizations. EMDR not only lessens the distress linked to traumatic memories, but also improves emotional regulation and coping skills, often working well alongside medication or other therapies. In essence, EMDR helps with intrusive thoughts by guiding the brain to reprocess traumatic memories through bilateral stimulation. This process lessens the emotional charge of these memories, helping them become less disruptive. It promotes the integration of traumatic memories into healthier, more adaptive memory networks, which weakens the grip of intrusive thoughts. As a result, individuals often find they can think about their trauma without feeling overwhelmed or consumed by distress. This approach is supported by scientific research and clinical guidelines, making it a trusted, evidence-based option for managing PTSD symptoms, including intrusive thoughts. If you or someone you know is considering EMDR, it's important to consult a qualified mental health professional to see if it's the right fit for your specific needs.